Mr. President, I come to the floor today as the Senate returns to give a doctor's second opinion of the health care law. As you know, Mr. President, because you've been here for so many of these every week since this bill was signed into law, I've come to the Senate floor as a physician, an orthopedic surgeon, as someone who's taken care of the families of the state of Wyoming since 1983, to give a doctor's second opinion of the new health care law and what I view as the impact that's going to have on health care in this country. You know, Mr. President, that during the debate and the discussions about this, at the time the health care bill and now the health care law, I had many reservations, because my concerns was it was going to be bad for patients, bad for providers, the nurses and the doctors who take care of those patients, and bad for payers, people paying for their health care costs as well as the taxpayers of this country. Well, you know, when the health care bill was signed into law, Democrats were extremely proud of that, and they were actually eager at that time to tell all of America about their vote. As a matter of fact, Senate Majority Leader, Senator Reid, had said, "This is a happy day." He went on to say, "We're going to hear an earful, but it's going to be an earful of wonderment and happiness that people waited for a long time." Well, here we are, Mr. President, just 6 months later. The new law is not greeted. It is not greeted with happiness. It is not greeted with wonderment. And now the Democrats of this country are singing a very different tune. In fact, Mr. President, 56% of Americans want the law repealed. And each week, as I've given my second opinion, I said it is time to repeal and replace this health care law. Now Democrats are completely changing their message about the new law. Now they no longer say that the law will lower costs. They no longer say that it will improve care. Instead, they now admit that the law has some shortfalls, and they are talking about how they are working to improve it. This law needs to be repealed and replaced. You know, I think now the people of America know what Nancy Pelosi meant when she said, "First we have to pass the law before you get to find out what's in it." That's what she said. Well, now the people of this country have found out what's in it, and they recognize it's not good for the country. There was an interesting article in the Wall Street Journal last Friday, Mr. President. Kimberly Strassel talked about the health care law, and she said a total of 279 House and Senate Democrats voted for Obamacare. She said, now, not one is running an ad touting the vote. How can they, given the headlines? But she does quote a number of Democrats who are running for election this year. Those Democrats are talking about why they voted against the bill that the president claimed would be good for the country. These are Democrats voting against what they call massive government health care. That was one member of the House. Another said she voted against the $1 trillion health care plan. And a former governor of Georgia, a Democrat, said, not only is Obamacare financially devastating, he went on to say, it is the greatest failure, modern failure of political leadership in my lifetime. Well, you know, Mr. President, while Congress has been out of session in August, Politico ran a story entitled, "Dems Retreat on Health Care Cost Pitch." And, Mr. President, I ask unanimous consent to include that article in the record.
Well, objection is so ordered.
Thank you, Mr. President. Mr. President, I thought it was just so important that more Americans should know about it. The article explains, it says, key White House allies are dramatically shifting their attempts to defend health care legislation, abandoning claims that it will reduce costs and the deficit, and instead are stressing a promise to improve it. Well, this new Democrat message strategy on health care was developed by key Democrat strategists and pollsters, and it was detailed in a 24-slide PowerPoint presentation. Well, the language in the presentation is remarkable, and it is radically different from what President Obama and the Democrats on this floor promised during the debate about health care. This new Democrat spin demonstrates that people who voted for this bad law now recognize how unpopular it is with the people of this country and how it will never live up to the grand promises. That's why, Mr. President, people all around the country were saying, don't vote for this, as people in this body were cramming this bill, and now a law, down the throats of the American people. Well, rather than walk through all 24 slides, Mr. President, I want to hit some of the highlights of the Democrat new health care message. Let's take a look at what they call challenging environment. They say straightforward policy defenses fail to be moving voters' opinion about the law. They say the public is disappointed, anxious, and depressed by the current direction of the country, not trusting. Voters are concerned about rising health care costs and believe costs will continue to rise. That's in spite of promises made on this floor that wouldn't happen. It said, Mr. President, women in particular are concerned that the health law will mean less provider availability, scarcity, an issue. And many don't believe the health reform will help the economy. Well, there is a reason that people don't trust Washington. There is a reason that the policy defenses in the new law fail to move voter opinions. And it's because the new law is not good for patients. The new law is not good for providers, the nurses, the doctors, the hospitals, the home health aides, hospice care. And the new health care law is not good for the people who are going to be paying the bill. Let's take the next slide. Make it personal. It said use personal stories coupled with clear, simple descriptions of how the law benefits people at the individual level to convey critical benefits of reform. Well, you know, Mr. President, there are a lot of personal stories that they won't tell you. And those are the personal stories, including the small business owners all across this country who are being strangled by the red tape in this law, strangled by rules and regulations and expense. And that's why we're looking at 9.6% unemployment in this country, because of the lack of certainty for small businesses and the increased expenses that they're having to deal with as a result of this law. They won't tell you the stories, Mr. President, of the patients with pre-existing conditions who had insurance, who did have insurance, but now are being penalized by the new law because they played by the rules. Well, let's take another look at another slide. It says improve the law. The recommendation of the pollsters to the Democrats is use transition or bridge language to meet the public where they are and relax their defenses. The American people know what they're talking about, Mr. President. They go on to say, the law is not perfect, but it does good things and it helps many people. Now we'll work to improve it. Well, Mr. President, the question is, does this new law help you, the American citizen, at home? That's the question. That's what people ask themselves. What is the impact of this going to be on my own health care? So they say, is the new law helping you? Is the new law helping small businesses that can't seem to qualify for the tax credit the administration and congressional Democrats promised? In spite of the fact that 4 million postcards were sent out to small businesses, only a very small number of those, a small percentage, could qualify for any of these tax opportunities. And who were those? Those were people who were willing to cut the salaries of their employees and maybe lay off others. That's how the incentives were built into this. And that is what we talked about during the debate and why we voted against this bill. Is this new law helping individuals who, thanks to the new administration grandfathering rule and regulation, will lose the employer-sponsored health insurance plan? Is the new law helping seniors who see more than $500 billion robbed from Medicare? Seniors on Medicare Advantage, a program they signed up for intentionally because they know there is an advantage to being on that program, because it works with preventive care, it coordinates care. That's all gone, Mr. President. Is the new law helping the 18 million people who will find themselves locked into the Medicaid program? Is the new law helping the millions of Americans who will see their health insurance premiums go up next year to comply with benefit mandates in the law. Mr. President, it says it is just that instead of working to improve the law now, those on the other side of the aisle should have improved it before it was passed. Members of my party repeatedly wanted to work with Democrats to improve this legislation. Unfortunately, we were shut out of the process. Well, let's take a look at the next slide, Mr. President. It says, blunt the mandate. Part of the New Democrats' spin, blunt the mandate. It says, tap into the individual responsibility to blunt opposition to the mandate to have health insurance. Wait, mandate? What is this mandate? Well, this is a mandate that everybody in America has to have insurance. All individuals have to have it. All employers have to offer it. People either must buy insurance, employers must provide insurance. There is a mandate, and currently 20 states are suing the federal government about the mandate. It also says those who choose not to have insurance and use the emergency room for routine care are increasing costs for the rest of us who have insurance. Well, Mr. President, let's look at a report from the Center for Disease Control. This is a report that came out in May. It confirms that, as opposed to what this slide says, it confirms that the uninsured do not visit the emergency room more often. You know who visits the emergency room more often in this country, Mr. President? It is Medicaid patients. It shows more than 30% of Medicaid patients under the age of 65 visited emergency rooms in this country at least once in 2007. This health care locks 18 million more Americans into Medicaid, forcing them into the emergency room because doctors frequently cannot afford to see them in their offices. So the question is, will these 18 million more Americans who have been locked into Medicaid, will they be able to find a physician to treat them? And if not, how will the emergency rooms of this country cope when these patients use the ER as their primary care provider? Mr. President, we all know that the health care law was modeled after the Massachusetts state health reform plan. Well, the Boston Globe reported on July 4th of this year that recent state data proved emergency room visits rose in Massachusetts by 9% from 2004 to 2008, about 3 million visits a year. And according to the Massachusetts Division of Health Care Finance and their policy plan, providing insurance coverage may have actually contributed to the ER visit increase. But the goal, Mr. President, was to lower the number of visits to the emergency room. Well, let's take a look at another slide, and it talks about what health care coverage members of Congress have. It says supporters of the law and those campaigning need to highlight that members of Congress will participate in the same plan. Well, it's important to remember, Mr. President, that the only reason members of Congress are on the same plan is because Senators Coburn and Grassley fought for this. It's also important to remember that members of the congressional leadership, their staffs, White House employees, and other federal employees will not be on the plan. And then let's look at the new head of Medicare and Medicaid, Dr. Berwick, someone who was in a recess appointment named to that post, a name that wasn't even surfaced during the entire debate of the health care bill. No one was in charge of Medicare and Medicaid during the health care debate. Why? Because the president chose to not even name someone. And then when the president finally named someone, this is someone who is in love with the British health care system, has made a number of quotes about rationing of care and ways that he envisions the British health care system is so much better than the U.S. health care system. And yet, he has, as a result of this contract, from the group that he worked with in Boston before taking this new job, a job that the president made a recess appointment, somebody that's never come to Congress to testify, never presented himself to the American people. I don't know what he's hiding. He doesn't have to live under the health care plan that has been forced down the throats of the American people, because his contract, when he left Boston, said he will get care under them for life, and so will his wife. So he's making rules and regulations that apply to the rest of this country, but not to him. Well, let's take a look at another slide, Mr. President. This has to do with Medicare cuts. The New Democrat spin says it is critical to reassure seniors that Medicare will not be cut. And then it says free preventive care. Well, Mr. President, this is absolutely absurd, and it is untrue. It is clear that the new law cuts $500 billion from our seniors on Medicare. And not to save Medicare. It does it to start a whole new government program for someone else. When I talk to seniors, and I've done this, Mr. President, all over the last month, traveling around the state of Wyoming, visiting at parades and at picnics and at fairs and at rodeos, the seniors say, you know, if you want to change Medicare to save Medicare, we can deal with that, but not to start a whole new government program for someone else. Well, the final slide, I think, Mr. President, is most telling. And it's a slide, it's a list. It's a list of the don'ts. The New Democrat spin says, don't assume that the public knows the health reform law passed. Or if they know it passed, understand how it will affect them. The slide says, don't list benefits outside of any personal context. The slide says, don't barrage voters with a long list of benefits. The slide says, don't use complex language or inside jargon. The Democrat new spin says, don't use heated political rhetoric or congratulatory language. And Mr. President, believe it or not, the new slide says, this is the slide that the Democrats pollsters have put out, says, don't say the law will reduce costs and deficit. Don't say the law will reduce costs and deficit. Well, Mr. President, let's take a look at some of the quotes we heard leading up to the passage of this law. Quotes, promises by the President of the United States, by House Speaker Pelosi, by Senate Majority Leader Reid. I mean, the President met with Senate Democrats in December of 2009 before a vote in the Senate. And he said, we agree on reforms that will finally reduce the cost of health care. He says families will save their premiums. He said this will be the largest deficit reduction plan in over a decade. Well, now the Democrats are being told, don't say the law will reduce costs in the deficit. But isn't that what the President said to the Democrats in December of 2009? The American people have been misled, Mr. President. The American people could see through it, and that's why they were screaming, do not pass this law. But yet, what the President said and what now the American people know to be the truth are the exact opposite. Well, let's take a look at what House Speaker Nancy Pelosi said. In March of this year, she said, this is a triumph for the American people in terms of deficit reduction. This isn't going to reduce the deficit. And now, finally, 6 months after it's been passed into law, the Democrats are admitting that this is not a triumph for the American people in terms of deficit reduction. And then Senator Reid from that desk, Senate floor remarks, November last year. He said, one of the major goals of the Patient Protection and Affordable Care Act is to lower federal health care costs and reduce the deficit. He then says, our bill does that. Well, Mr. President, the bill signed into the law does not do that. And now even the Democrats with their new spin are saying we better not keep saying it because the American people don't believe it. And that's why 56% of the American people want this law repealed and replaced. You know, Mr. President, the American people are sick of the spin. The American people deserve the truth about the new law and how it will impact their lives. It is clear, Mr. President, that this law is not good for patients. It's not good for providers, the nurses and the doctors who take care of these patients. And it is not good for the payers, the taxpayers of this country and the people who pay their own health care costs. We need to repeal and we need to replace this new law with a plan that will actually help our country. Thank you, Mr. President.